Good morning. So after yesterday, are we feeling courageous? That's not an answer. After yesterday, are we feeling courageous? That is the answer. That is certainly what I'm feeling. That is the answer I was hoping for. Um, because the sad reality is no one is coming to save us, but many are coming to join us. Look at this room. I don't even know how many we have online. Well, I'm sure our colleagues on the West Coast aren't online yet, but we have at least as many joining us virtually as are here. And because last year, I think I said something to the effect of that once we were few, but now we are many. And being many is our strength. And once we were largely alike, but now we are increasingly diverse. And that too is our strength. Turning our strength into power, however, requires that we continue to become more diverse. I'd like to ask you another question. How many of us here in the room consider ourselves to be conservatives? Wow. Okay. I hate to say it. But yeah, you're the only one, but that actually works. That actually works really well for my purposes today, because the point I wanted to make this morning before introducing the senator is that growing our political diversity is absolutely key to turning our strength into power. And although no one is coming to save us, by inviting our conservative brothers and sisters into this conversation is going to be the key to us becoming more powerful. So without further ado, it is my pleasure to introduce the man who is going to be our keynote speaker this morning, who is helping us do exactly that, becoming a more diverse movement. Senator Frist is a heart and lung transplant surgeon and a former United States Senate Majority Leader. He founded the Vanderbilt Multi-Organ Transplant Center, which is now the busiest heart transplant center in the world. From 1995 to 2007, he represented Tennessee in the U.S. Senate, where he was instrumental in 3 absolutely incredible public health contributions. The establishing the 2003 Medicare Modernization Act, which established the Medicare Advantage and the Medicare prescription drug benefit. The historic PEPFAR program, which we could talk about all day today because it is so important and so imperiled, but which provides life-saving HIV treatment globally to 25 million people, and the Senator Paul Simon Water for the Poor Act of 2005, which promotes worldwide access to safe and clean water. If ever there were important public health contributions, they are those. Now, Senator Frist serves on the steering committee, of the National Academy of Medicine's Grand Challenge on Climate Change, Human Health, and Equity. He co-chairs NAM's Action Collaborative on Decarbonizing the U.S. Healthcare Sector, and he co-chairs the National Commission on Climate and Health Workforce. Senator Frist is also currently serves as the global board chair of the Nature Conservancy, the largest conservation organization in the world. At Nature Conservancy, he and his wife Tracy have established the Senator Bill and Tracy Frist Initiative for Planetary and Human Health, a transformative initiative focused on driving solutions that simultaneously improve human and planetary health. And isn't that what we are all about? So please join me in welcoming Senator Bill Frist.
I couldn't see it from the back because I was sitting down here. Maybe that's why you said sit on the front row. How many conservatives are there here? Are there a couple? That's pretty good. I think it does really hit right at the heart of what we need to do, and that is to take where we know we're right on the science, we know we're right in terms of health, although our voice, I think, can be pretty unique, and do the right storytelling with where we are today, which, to be honest, and I will say we hadn't done the job we need to be doing coming in. And as you go around the Hill tomorrow, those of you who'll be doing that will basically, see you'll be hit with things that you'll say, this is just foreign. It is foreign in many ways. But it really shouldn't be, because we're in all this together. And I'll talk a little bit more formally about why that is. I'm here for the day. Yesterday I was here, but I was with my son, who grew up here in Washington, where I spent 12 years as majority leader, representing 6-7 million people initially in Tennessee, and then about 350 million people in this country as the leader. Yes, majority leader, but I was responsible for leading 99 other people, and they elected me to that position, in large part because the sort of issues that I concentrate on myself are things like nature and health and education and climate and biodiversity. And to me, all of that mixes together with being a heart and lung transplant surgeon, where I focus one-on-one. And when that person comes through the door, it's the most important person in the world to me and to them. And taking whatever their needs might be, and taking the best I have in science and bedside manner and empathy and emotion, and then marching with that person through. And what I did is taking their heart out and putting another heart in, or their lungs out and putting them in. It's built on trust. And I'll come back a little bit, because we do need to do a better job in building that trust. How do you do that? And that's why this conference is that important, and what you're going to do today. I do want to introduce Joan Hamilton. Joan, where are you? Joan, just stand up, because I'm not going to be able to speak to everybody, but Joan's my arm with me today. Joan and I just got out of Brazil. We were in the Amazon rainforest, and we were in Brazil for about 10 days, and I have an article coming out in Forbes later today. It has nothing to do with anything we're talking about, but as a doctor, I talk about our trek through the jungle and all the medicinal uses of the plants, linking with healing and inflammation and cancer discovery and quinine and the trees that are there, that led to the discovery of a first treatment for malaria, saving millions and millions of lives. So people say, well, how in the world and why are you so interested in the climate, in biodiversity, and in nature? And you'll see, to me, it's all the same thing. It's individuals, lifting them up, better life, better well-being. You have to identify the factors that influence that. And we've got unstable weather patterns. We have loss of biodiversity. We have the hotter days, which we're going to follow with in 30 minutes, and talking about the impact that it has on real people's lives and well-being. So you can see, for me, the conservative or liberal or progressive and all, it just doesn't matter. It just doesn't matter. So we got to kind of all get over that. And it's hard to do in this environment when you've got people just telling you, slapping you in the face. Getting up today, my friends from the Nature Conservancy are over here, getting up today and opening whatever it was you read and see that the administration made, come in and deforest the sort of things that we're looking at 4 days ago on the ground in the rainforest, hundreds of miles from the nearest city, which is where Joan and I were. I mentioned Joan because I want you to meet her, talk to her. We'd like to keep collecting stories that you have, connecting us with real people on the ground to improve their lives, their health, the connectedness of what you're all about in terms of the world and planetary health, and what we do in terms of soil and biodiversity and climate change and unstable weather patterns and acidification of the ocean, connecting it to you, to me, to our kids, to our children, to our grandchildren. So to me, it's easy, but I know the challenge that is out before us coming forward. So let me cover a little bit of ground, and we'll finish on time. And for questions, probably don't have time for a lot of questions, but again, I'll be around all day. So whoever's doing the microphone, you figure it out how to do this or that. So here's the way I see it. The current administration will continue, as I mentioned today, to dismantle a lot of the progress and structure and infrastructure in climate policy, and they're doing it from the top down. They're starting at the global level. We kind of look a little bit at what USAID and what is happening there. Then at the federal level, we're seeing the policies, and there will be probably an extension down to the states. And I'm thinking mainly of California, or an attempt to do that. And that's the reality of where we are today, and there is a master plan. It's by a handful of people at the top. It does not reflect where the American people are. And of course, I'll come back to that. That's where our hope is and our job and our call to action is. And it will, and I hate to say this, but the reality is, from somebody who's lived in this town, know how it works, it's going to get worse. And what we know today, you say it can't get any worse. It's going to get worse from where we are today. But that's not where the American people are, and it's not where science is. And we need to do a better job reflecting where science actually is. And that's why I have Joan here, and we're working because we need to translate the science that we're not alone. We're not alone in this room. We're not alone in America with what we believe. 70, 80% of people are with us. Now, the challenge is getting that to the very top and keeping it connected. That's what democracy is all about, and we're not going to give up on democracy. We're not going to give up on democracy. Now, so here's the way I look at it. We've got, how long? Earth is probably 4.5 billion years old, but we have 300 million years or 300,000 years of human existence. And we know from that, it's taught us the simple fact, and that's when we, and this is evolution, of course, are faced with these insurmountable sort of challenges, whether it's tigers or it's insurmountable changes that we're going through today. Evolution and nature has basically said, get rid of distractions and focus. And that's the way you're going to survive. That's the way you're going to thrive. That's the way you're going to prosper. That's the way you're going to move to the future. Evolution has taught us to be clear-eyed and to become focused, not distracted, but it also gives you adrenaline, epinephrine, norepinephrine for all of you, energy that you wouldn't otherwise have. So the challenge that we have, and I really kind of beseech you, don't get lost in the moment. Which, you know, it's hard to think, we're only 5 weeks into the moment, but don't get lost in the moment. I think what we really do need to do is kind of like what evolution has said. Be disappointed, be mad, be angry, be ready to just sort of fight, but take all of that and wrap it up. Put it kind of in a balloon. Don't let the balloon go, but you can still hold on to the balloon. But move the balloon over to the side, package those up, and then with that same energy and that same discernment and a new focus, which we'll be defining over the course of today. Today's a journey and an arc, I'll come back to that, which I'm excited about, we'll be able to address. And then this charge ahead, and then I'll just play off you, and I'll do it again. It does come back to courage. But courage is something we can all muster, but let's kind of stick with that word as we come through. I'm optimistic. I'm a pretty realistic guy. I mean, I didn't, whether it's the Nature Conservancy or running the Senate or doing heart transplants, you know, I'm not I'm not naive, but I am optimistic. You can say hopeful or optimistic, and I'll tell you a little bit why. I think the courage end of it is looking deep within ourselves and recognize at the same time our communities are getting hotter, our weather more extreme, our oceans more acid, our air more polluted, because it's inevitable when we're pulling back that those sort of things are going to happen. Our job is to come together, is to align, is to act. And to be smart, but along the way become smarter, to work harder, which we can do. And I know it's hard to imagine working harder, but also to do more together, of making relationships here and then capitalizing on them with me, with others as you go forward. To respect others, but that doesn't mean don't fight. It means to fight in a civil way and to rely on hard data, but that's not enough. Demand the hard data, demand the transparency, the accountability, but we've got to be able to communicate that data and what we're learning with more storytelling, more real life. What's the intimacy? Why does it matter to you? To aim for the planet, because it is planetary health, it is global health, it is the world, it's the soil, it's the air, it's the oceans, it's the streams, it's who we are today. But it all starts local, in our own communities. And that's where we got to be good, to take the local, master the local. That's what Joan and I want to capture, those local stories. And then we've got organizations. We know how to take things to scale. The journey over the course of the day is really our opportunity to channel this focus that we're kind of forced into now, but to channel this focus and this new energy, to really expand our reach and to better communicate what we have learned, to accelerate the momentum that we have definitely seen over the last decade, two things I've mentioned that are going for us. Number one is science, and I'm a medical scientist. That's what I do. I've written hundreds of academic papers in academic journals. I missed the session yesterday, but again, this conference is laid out so beautifully about how better to publish coming in. But I am a scientist, and the other thing is the American people. The science is kind of where we are, whether it's science in a big sense of the clinical, the touching people every day, the academic health centers, our community health care systems, the work with the National Academy of Medicine, or what we'll talk about working in the workplace. I think science itself is misunderstood. It too is under attack. And only by looking and us doing a better job with transparency of the science, its limitations and its advantages, of the accountability, of the accurate reporting, and then the follow-up to make sure that the science, because science changes over time, but science really is, I think, at its best when it defines nature. And I do think it's humanity's best chance to define truth. And this sort of truth, which is science and defining nature, is the best sort of weapon I think we have to counter the misinformation that is hitting us from all sides. It's haunting us day and our kids on the internet and what we have today. But we've got to make it understood that the science is clear. It is clear on climate. The consensus among scientists is there. We know that. And yeah, there are going to be a few outliers, there are in everything in life, but the consensus is there. But do our families fully know it? Do our school kids really know it? Do our teachers really know it? Not yet. They still think, because they hear it, the misinformation, that we're not together. Second, the American people. I believe in the American people. I mean, I'm a regular guy from Nashville, Tennessee, who's had dreams, but by working with people have tried to make those dreams a reality. And I've gravitated to the service end of it. But in large part, it's because of my belief in community and people and pulling them together and aligning them left and right and black and white and north and south and all that. It doesn't matter. It's like seeing a patient come in. You treat that patient wherever they are, whatever, and it's no different than that from my standpoint. But the American people are with us. The informed are with us. Those paying attention are with us. Thus, our job has got to be to bring more people to the table, get more people in this room. We double it this year. We'll double it next year or triple it next year. And just looking at the notes on the climate change in the American Mind 2024, if you look through that carefully and study it, and I love it because it stimulates thoughts for me. You see the progress has been made since 2014, but that we also have a long way to go. And you can almost use it as a template of where we need to focus in terms of a policy level, in terms of a programmatic level. Just looking at a few other things, 39% of Americans think global warming is currently harming the health of Americans in general. And that's a great foundation to build on. 39%, 40% is a political figure. If I had 40% of people with me understanding it, I knew I could build it. Because you can double it if you have the right programs and the right initiatives coming in. Health is personal. Health is intimate. Health speaks to our caring for our loved ones and children. Thus, health moves people. People care about their health. 19% of Americans think global warming is currently harming their personal health. What we need, that's good, but we need to build on that the trend, the trajectory, and the inevitability. That's just 19% of people, so we got to get more people understanding that. The inevitability that individuals' health, your children's health, your grandchildren's health will definitely be impacted. 37% of Americans identify at least one health problem linked to global warming. For those of you who were here yesterday, I mean, the whole mental health, and people just don't think necessarily, they don't make the connection. So clearly we can double that over time, that people understand it's not just one health problem. It's not just physical health. It's mental health, and it's a heart disease. The Nature Conservancy, we got a great study right now down in Louisville, Kentucky, which shows trees are the intervention. Trees are the medicine in terms of changing people's lives. They have fewer heart attacks. They have fewer emergency admissions. They breathe better. C-reactive protein, because all of you know that, goes down just by planting trees in a neighborhood in a side-by-side clinical study funded by the NIH. 65% of Americans view coal as harmful to people's health. Of course, 38%. And the good news there, that's up from whatever it was in the 20s in 2014, expressed the same concern about natural gases. That's good, but that's the aggregate, and what we need now to do is personalize. And the last one I'll mention, we'll talk over the course of the day, but 34% of Americans, or about half of Americans, compared to 34% 10 years ago, believe that some groups of Americans are more likely to experience health consequences from global warming. And that's good. The disproportionate impact of the marginalized and the vulnerable, that's good in the aggregate. But then only 1 in 5 Americans, or 18%, identify low-income individuals. So we need to articulate, so that's the obvious one. And then we'll talk about pediatrics later today. We'll talk about children being those vulnerable populations. We'll talk about seniors and the frail elderly being. We just need to communicate that because people care. People fundamentally, forget the party stuff, people care. It's in their DNA, it's in their genetics. So all of that, the data you know, you reviewed it yesterday, we'll keep coming back to it, but the data tells us where to go. Over the course of the day, it is it's a trajectory, and the conversations are going to be important. We're going to talk about, right after this, local and state opportunities to address heat. Everybody gets it. Everybody gets it. The days are getting hotter. It's not just the heat, it's also the extremes coming across. And then we're going to roll into the decarbonization of our own sector of healthcare. Ed mentioned the National Academy of Medicine. We just wrote a paper with several of you in the room here today about decarbonization in the healthcare sector. There's so much more we can do. I'm on the board of public health companies. When I ask the right question in the boardroom and people say, no, what's this climate change stuff? And they address it, because I'm on the board, so I can say, address it at the next meeting. They come back and say, good gosh, these hotter days are wearing out our air conditioners in a way that's costing us a huge amount. Yes, these hurricanes are shutting down our hospitals where we're not giving care. Yes, the infrastructure and transportation itself has been destroyed because of inadequate planning. And then we're going to roll into the case study of plastics, which I'm excited about, then explore the connectedness between, as we talked about, the climate change and children's health and pediatrics. And then in the afternoon session, we're going to be playing with a lot of the tools themselves. So this trajectory over the course of today really gives us a chance to further define, capture this newer focus that we're going to have in this really unique position we have because we are the trusted partners in healthcare. In just a remaining few minutes, because we're going to stay on time today, there are lots of things that I could share in terms of, well, let me take 5 things real quickly and a couple of minutes on each, or a minute and a half. I'm hopeful, and Ed suggested this, because in my years, 20 years in medicine, clinic, writing papers, taking care of thousands of patients, doing hundreds of transplants, and 12 years in the policy world, where many of you will be tomorrow, and then the last 15 or 16 years building healthcare companies, and working with the Nature Conservancy and working with Robert Wood Johnson Foundation have focused a lot on vulnerable populations. But if you put all of that back, there are several things. 2 grand movements, Ed mentioned sort of 3 which are good, but 2 taught me that these seemingly insurmountable things can be done. You don't know if you're an individual, you know, and you see the policy stuff and the chaos and the confusion and all that stuff. Can big things really be licked? Can it be done? Just in my experience, I'm not going to go into them, but Ed mentioned really one of them, and that's HIV/AIDS. When we started with that, when I came to Washington as the first physician in the United States Senate since 1928, doctors just hadn't, and nurses had not been in policy until I came in. We took on HIV/AIDS. HIV/AIDS was killing 3 million people a year. 23 million people had it each and every year. 3 million people dying. The United States had not stepped up at all globally. I worked 6 years with Clinton, 6 years with Bush. Both of them came together. We did PEPFAR, and now there are 25 million people alive because we took what was an issue that was more polarized than climate, starting off with, and over a period of time, chipping away, defining, using the right language, getting the stories right, we were successful. And people say, yes, but the USAID is gone. We have set up an infrastructure because of the American people, reflected a polarizing issue through the top, a lot of hard work, a lot of storytelling, a lot of adjustment on language coming through to a program that is going to be around forever, regardless of what happens with funding today. 25 million people alive today because of that program led by the United States, but also had the global community. And the other one, which Ed and others have talked about, and some of you in the room had been around long enough, was smoking. And again, I'm a lung surgeon, I'm a heart surgeon. That's what I do, this part right here. And when I'm in Africa doing work, I'm working on everything, but this is what I cared about. And at that time, lung disease in terms of cancer, in terms of COPD and bronchitis and the morbidity, unbelievable, all because of smoking. And everybody smoked. Everybody smoked. Exaggeration a little bit, but everybody smoked. Impossible, industry, all against it, but through organization, grassroots, local, and ultimately policy itself, once we could mobilize the people, it was not cured, but right now, millions and millions and millions and millions of people. So just seeing those, when I think of where we are with climate, we're going to get this done. It's just how smart and how quick we can get it done. Number two, human health. And this is, we all know it, you talked about it yesterday, we'll talk about it all day today. The intimacy of human health and being able to tell that story does bring people to the table. Begin the conversations not with legislation or a bill or how bad Republicans are and all of that stuff. Begin with what brings them together is that climate affects you, will affect your children and your grandchildren. It's what the science shows. It is inevitable. And then a couple of examples coming in. We can pick up some with the heat talk, which is right after mine. But over the course of the day, write 3 or 4 of those down and lead with those. And if you lead with those because people care about health, then they will sit down. And you got about 80% of the battle there. Because if you can get people to sit down and talk civilly about the issues, the American people are with us and science is with us. Number 3, policy does matter, but don't get lost in the policy because right now you get so discouraged, you're going to give up. These shifts are there. Now, this is an extreme shift we're going through. But what we can do is get to know your congressperson, get to know your mayor, it's not just in Washington, it's probably more important than ever to get to know the people in your community, your local councilman. We all know there's 3 groups of people. You, in the healthcare world, we say you're the doctor, but it could be the nurse, the provider, the doctor, whatever it is, are the number one trusted. And that's our responsibility that when we walk away from this conference, most of the people we see over the course of the day, they don't fall into that category. So that puts the responsibility and the real impetus behind your work. And then we know first responders. And when there's a doctor or a first responder or a scientist or an expert, what I do when I'm in a nonprofit board or a for-profit board, I make sure one of those 3 people are in the room all the time. And then they can reflect the story and the storytelling as we give the science coming in. So encourage to use them. And if we use them and their trusted voice, we will have a much faster impact. 5, and I'll close with this one so we can keep moving today. Nature-based solutions, and as I look through the program, we don't have a lot in there. So this is really, really important, I think, for you just to listen just 1 minute to. The nature-based solution, now I'm biased because Nature Conservancy, we're big. We do 3 things. We convene people like this. We have 1,000 scientists working with us, 1,000 that work on our team. We start local, but we go global. We were at the Amazon, we were in Belize, we're all over the world. We're in 77 countries, but it starts locally coming in. So we have the size to do that, being science-based. We lead, of course, with nature-based solutions, and with not much on the agenda, just a couple of things on it. It's important because nature is important. I'll give you the date on that, but it's equally important because people love nature. People love nature. After COVID, it brings you down. It affects your stress hormones. There's all sorts of, obviously, chemical reasons of cortisol and the like, but it also brings people to the table. So it's a great way to begin the conversation. There's agreement. Always where there's agreement and alignment, you pull people in when you're talking to them and teaching to them. More than 94% of Americans support protecting, managing, and restoring forests, grasslands, and wetlands so they can store more carbon and fight climate change. 94% of Americans. What are these natural climate solutions? They involve the protection and the management and the restoration activities that avoid greenhouse gas emissions and increase carbon storage. You all know that. But across our forests and across our grasslands and in our oceans and agricultural lands and in our wetlands. And they include practices like forest management, appropriate forest management, helping local people who have forests, who own trees privately and publicly, to help them understand how these trees store carbon. Reducing fertilizer use, the farmers are important. We have a farm bill that's coming up, the regenerative agriculture that is there, all ties right into climate change. Those of you who live on coast, restoring our coastal wetlands have a huge impact in the sequestering of carbon in the submerged soil beneath those oceans. What's the impact globally? These natural climate solutions could deliver up to a third of the emission reductions needed by 2030 to avoid the worst impacts of climate change. In Mongolia, just an example, we have a major initiative that we just signed last year, and that will help Mongolia avoid or increase capture of up to 240,000 tons of carbon dioxide annually by 2030. Today, more than 130 countries have these natural climate solutions built into their climate change plans coming in. So I'll close. It's 8:32, so I'm going to close. You in this room, more than any other room that I speak to, you are, and that's why I'm here, that's why I'm interacting, that's why I love what you're doing, that's why I'm going to continue to support and take what I hear and amplify it tomorrow with the leadership of the United States Senate and people around the country, because you are the trusted voice. You, on climate, on health, on human well-being and how it comes together, this connectedness of planetary health, the connectedness to human health. And you are, through our trajectory today, the ones who can connect the dots. You are the ones who can give momentum. You will build the public will to prioritize the equity issues around health, the marginalized, the vulnerable, the moral issues that are there, but most people don't think about. So today, let's all lean in, let's link arms, and by doing that, I'm absolutely convinced, I'm positive, it may be an old guy telling you this, and I'm out there fighting the battle with you, but I'm positive by leaning in, by aligning, by listening carefully today, by engaging and working together, we together will make a huge, huge difference. Thank you. Looking forward to today. Thank you.